What do we mostly do? What do you think? Fillings? Okay.
Lots and lots of fillings.
Fillings. Why am I filling silver and should I change them?
Ooh.
Well, they're not really silver, are they? They're an amalgam of things.
Yeah.
So, mixture of tin, copper, zinc, more importantly mercury. But there is silver in them, and this combination of metals makes it look silver. It does corrode after a while, so it does turn black after a while. And we used to polish them. I don't know if I'm a bit older maybe than both of you, but you used to polish them. We used to have amalgam polishing kits and polish the amalgams.
I don't think I've never used it after I finished university.
Yeah, but we were given this at university. We used to polish them and make them look really nice and shiny.
Shiny, yes, you're right.
And then we realised actually that we've been doing this for years, honestly about 100 years, and then they realised actually they're releasing more mercury by doing it. So they stopped doing it. So that's why they're silver. Now, as to whether we should replace them or not, well, it depends on whether they need replacing. I think that silver fillings have a place in dentistry. They are still the bread and butter of dentistry in most European countries. Scandinavia's banned them for various reasons, but generally we still use them quite a lot in Europe and the States. And how about Canada, do you see?
Not much.
Not much. Okay. But we use them for a reason. They're strong. They don't irritate the nerve as much as the white fillings do. They are very long lasting. They're very cheap compared to other filling materials. But they're not the greatest filling material in the world. They are heavy, so I find that if you leave them too long, they crack the teeth to a certain degree. And to be honest, this mercury debate, whether this mercury is harming the body or not, although it's still a debate, if we have better materials, we should be using them rather than using something that's very old-fashioned. I think we spoke about this last time. I think there was a debate about whether the mercury harms the body or not about 5 years after these silver fillings were invented, back in the 1800s. And ever since then, people have been trying to prove that this mercury is harming the body. Now, if there's even the slightest shred of evidence that it does, then we have better materials, then we should be using them. So I think change them for ceramics if you need to. Ceramics are better filling materials, they are stronger. If you don't need to, because they're not decaying or they've been placed 5 years ago and they're absolutely fine,
them, right?
leave them well alone. Because
Because when you remove it, you expose mercury
more
more.
mercury. Yeah.
So what's the point?
You release more mercury by removing them. So I wouldn't put another silver filling, if I can avoid it, I wouldn't do another silver filling anymore because we have better materials. Even the normal white filling, the composites, they're getting stronger and stronger. So there is a place for them, but I still prefer the ceramics over the silver or the composites, I think.
Yeah, I'm along those same lines as well. I mean, if there's no sensitivity, no cavity,
And they look
you know,
great.
the patient's not complaining of anything, then yeah.
The only reason why I change them, even if there's no cavity, is if they're cracking.
Yeah,
if the
of course.
tooth is fracturing around it, then
There's wear and tear.
Yeah, because you've got to be careful not to leave it too long, otherwise it can break the tooth.
Sure.
Especially in grinders.